All right. So once again, hi to you all. Thank you so much for joining us and welcome to this event sponsored by UNAIDS, UNDP, the Center for Global Health Policy and Politics at Georgetown University's O'Neill Institute for National and Global Health, as well as GNP+. My name is Alice Mutebi Kayongo. I work with the O'Neill Institute at the Center for Global Health Policy and Politics. And we are here for a community discussion around the HIV Policy Lab new report that was launched yesterday, and it's titled Progress and the Peril, HIV and the Global Decriminalization of Same-Sex. This report has been co-authored by Global Health Policy and Politics, authored by UNDP, and authored by GNP+. It reviews the state of laws criminalizing same-sex sex across 194 countries as tracked by the HIV Policy Lab. You may find this report in our chat. It's on the website, and the website will be shared with you in the chat. Please feel free to download and read more about the report. Otherwise, for today, we have a panel featuring representatives from the O'Neill Institute's Global Health Policy and Politics, from UNAIDS, from UNDP, from GNP+, from C-HELP, and UKPC. They will be presenting and discussing the significant findings in this report. And some of these findings will actually include the recent landmark event of decriminalizing same-sex relationships. They will also focus on the correlation between criminalization and advancement of the global AIDS response, decriminalization and the advancement of the global health response, and the concerning resurgence of the anti-LGBTQ legislation, as well as persecutions and discriminatory practices. I must admit that this report is incredibly thrilling, that I get tempted to preempt what is in there, but I don't want to at all in any way spoil what we have. So rather than take so much time, I will actually hand over to the director of Center for Global Health Policy and Politics, Dr. Matt Kavanagh. Matt, please take the floor.
Thanks very much, Alice, and thank you all for joining us today. We are really thrilled to be able to share with you this report from the HIV Policy Lab that is a year in the making, trying to focus on this core question of HIV and the decriminalization of same-sex sex. And so I'm going to run through a number of the key findings and show you this brief PowerPoint before opening to a broader discussion about kind of what's the meaning of this. We deeply appreciate all of you for joining us today. So first off, let me just say that a decade ago, the Global Commission on HIV and the Law joined most of the rest of the AIDS response, but brought it to a higher level, calling on countries to change their approach to same-sex criminalization. That in fact, the criminalization of LGBT people around the world was proving and continues to prove a major barrier to ending HIV infections, stopping AIDS deaths, and being able to put us on track to end the AIDS pandemic. And so here the Global Commission made that call, and member states of the United Nations responded in 2021 by making a clear call for the decriminalization and the removal of countries' legal and policy environments that were punitive and that were undermining access to HIV services. The Global AIDS Strategy called for a reduction to less than 10% of countries criminalizing same-sex sexual relations by 2025. We know that this is life and death. We know this is about human rights. We know this is about people's lives, as well as their ability to stay HIV-free. And that call by member states was actually unique. We haven't seen a call for law reform embedded in a UN document quite this way. And so the HIV Policy Lab, which is a partnership between UN agencies, civil society organizations, and academic organizations, has been measuring the HIV-related law and policy environment for several years now, we track 33 different indicators and laws around the world across 194 countries. And this year we focused in deeply on measures of decriminalization. We measure two different pieces. And so the first is the de jure content of law as written. There, we ask whether or not countries refrain from using law to criminalize consensual same-sex sexual acts. That is the law as written in, on the books and as adjudicated. Then there's a separate question, which is, does the country actually avoid prosecuting people for these same activities? LGBTQ people not only face being illegal in law, they face prosecution and arrest around the world. The Global Commission on HIV and the Law, as well as a wide variety of UN agencies and technical agencies, have called for moratoriums. Where there are bad laws, can we have a moratorium on them? And so this measures whether or not that is happening in the very best way we can. It's imperfect, but it's the best indication we have. So what did we find? First finding, at the start of the AIDS pandemic, the vast majority, 2/3 of countries, criminalized same-sex sex at the start of the AIDS pandemic. Today, 129 countries do not criminalize same-sex sex. That has been a reversal of where we started to where we are. In fact, today, 2/3 of countries do not criminalize same-sex sexuality as written into law. This is a sea change from where we were, and it means that today, 63% of people living with HIV in countries around the world live in places where same-sex sex is not illegal. That said, 1/3 of countries don't actually have not yet removed their criminalization. They continue to criminalize same-sex sex and LGBTQ people. And so that remains a major barrier to ending the AIDS crisis. But the fact that we've gone from most countries criminalizing to most countries not criminalizing is a huge, recognition of the work that has been done by communities around the world. Between 2017 and 2023, what we saw was that 13 countries removed criminalization. Just in the last few years, 13 countries. And it includes major parts of the global economy, such as India and Singapore and Angola and Botswana, and a wide variety of countries around the world. We've seen some of the countries with the highest rates of HIV. We've seen the fastest progress in the Caribbean. And so we see a real move around the world to decriminalize. This shows you the regional progress. And what we've seen at the very top of this slide, on the very top of each of these squares, what you see is the 10-10-10 target. As a region, are these countries reaching toward the 10-10-10 target? And what we see is the fastest progress is being made in the Caribbean and being made in East and Southern Africa. These are places where governments are changing the laws, legislatures are changing the laws, courts are changing the laws, and it's mattering quite a bit. Just one note then on prosecutions. We measure, as I said, whether or not there are any reports of recent prosecutions, because that gives us a sense of the relative policy about whether or not government has decided that it does or does not want to enforce the law as written. And in 24 countries, we have a law that criminalizes, but a de facto policy of non-enforcement, where we can find no examples of recent enforcement. And that is important progress, albeit short of full decriminalization. The health impact this has had. What we show in the report is two different studies that look at the effects, both on HIV for gay men and other men who have sex with men, as well as on the entire population. And what we find is that, on the one hand, in countries that criminalize, the gap between men who have sex with men and all men is bigger. So that on average, gay men and other men who have sex with men have higher rates of HIV than all men in the population. But what we find is that amount is 7.2% higher in countries that don't criminalize. But in countries that criminalize, the difference between gay men and other men who have sex with men and all men is 24.8% prevalence rate difference. That is a major difference. That's the effect of law right there. And what we also find in the numbers on the far side is that among the entire population, criminalizing countries have made less progress. And those that have removed criminalization have achieved higher rates of HIV knowledge and higher rates of viral suppression. That said, amidst all of the progress that's been made, there is, of course, deepening criminalization in some countries that are really out of step with global trends. Some countries are not just criminalizing same-sex relationships, but new bills are being proposed, and some have been passed, to impose harsher penalties, to include longer prison sentences, to expand the scope of criminalization, including imposing sanctions on some of those who help or support populations, including part of the AIDS response. This is a globally coordinated effort, and we should recognize it as such. We see this happening. In addition, the report walks through the criminalization of trans people, especially trans women who face particular risk of HIV, especially and are often considered men under same-sex criminalization statutes, but also looking at the reality that trans folks around the world face the use of indecency and vagrancy and loitering laws that systematically criminalize these populations. We should note that it's a wide range of countries. While it is the minority of countries, it is a wide range of countries. It's everybody from Hungary and Russia and Uganda and the United States of America, which is increasingly putting criminalization onto trans people. These are trends that we really need to push back against if we are to see the end of the AIDS pandemic. A few more brief points from me. One is just that non-discrimination protections are existing around the world and are another critical part of what it takes to do not just removing criminalization, but having proactive, positive policies that fight the discrimination against LGBT people. These two have been linked to better HIV, but less than half of countries that don't criminalize same-sex sex have these kinds of protections in place. Two additional elements that exist in the report that I won't walk through. One is a set of case studies of decriminalization, and you'll hear from Vivek Devan about one of these, that really show that actually many countries that seemed unlikely to criminalize just a few years before actually have had successful decriminalization campaigns. This is a possibility, this is a reality. And that courts and legislatures have all acted. And so each country has chosen a different path to how to get to decriminalization, but much of it seemed impossible. And it's really been about those investments in the AIDS response, as well as investments by the broader community in ensuring that that kind of work can happen, that brings together government, experts, civil society experts, people from public health, and has brought together legislators to lead and judges that lead have done it. The other piece, just briefly, is that we make the economic case and show the significant positive impact on GDP from criminalization, an important argument for many governments around the world. And so let me just say, I won't read these deeply, but there's a wide variety of lessons for the AIDS response that we can discuss today, and I will turn it back to my colleagues for a deeper conversation. Thanks, Alice.
Thank you so much, Matt. I told you that the findings, that we will present to you today will be very exciting. Many of us have heard about these things in the past, but we did not have that evidence. So we are thrilled that we now have evidence to equip us with very good information for us to be able to reach out to key decision makers for change. We do have a very strong lineup of panelists. We have Florence Riako Anam, who is the co-executive director of GNP+. Welcome, Florence. We also have Richard Lusimbo, the Director General of Uganda Key Population Consortium. Welcome, Richard. We have Ludo Bock, who's manager of the SDGs and UNAIDS HIV and Health Group in UNAIDS. Welcome. We have Vivek Devan, who's the head and coordinator of Center for Health Equity, Law and Policy in Indian Law Society. Welcome, Vivek. We have Umunyana. Umunyana, are you here? Maybe not. But yes, once Umunyana joins, we will be letting you know. Otherwise, I will shift to my colleague, Florence. Florence, we have heard the presentation that Matt has made, and I just want to ask, as we examine the intersection between decriminalization and same-sex relationships and the HIV response, how do these two intertwined factors influence the effectiveness of public health services and strategies?
Thank you so much for allowing me to join the call. And hello, everyone. I am excited to be here to give our perspectives as the global network of people living with HIV, having worked together within the HIV Policy Lab for this report. I think the global AIDS response has for decades understood the critical need and impact of the protection of human rights in stopping HIV transmission and ending AIDS deaths. Criminalization continues to drive people away from HIV services. So that is how the intersections occur. If we are to end HIV transmission and AIDS deaths, we have to have everybody who needs prevention, intervention, access them, and everybody who needs treatment, because we know the power of treatment to ensure we have quality lives. We also know the opportunities of treatment in ensuring when a person living with HIV is undetectable, they cannot be able to pass the virus to someone else, as a critical time in the movement for which this science can help reduce new infections. We also have a lot of biomedical and other services that can be able to prevent HIV, which many people living with HIV, but people who are vulnerable to getting HIV are put away from. And one of this is the criminalization of same-sex relationships. So people from the LGBTQ movement are not able to access services, are continuously being at risk of HIV infections. We are seeing that from the data that keeps coming year after year, particularly for Africa, where the numbers keep increasing every day. We cannot continue to put our heads under the sand anymore. We have to follow the science and make it possible for people to access prevention and treatment services. I just want to highlight something out of our experience as GNP+, one of the members of the Love Alliance program that is funded by the Ministry of Foreign Affairs of the Dutch government. Our work is to support Africa key population-led organizations to build their movement and advocacy for access to sexual and reproductive health and rights and HIV services. For all the work that happens, particularly in East Africa this year, we have faced the highest impact of threats and attacks, which have diverted our attention from working towards what would be the best for us, addressing law reform, addressing policy reform, so that then services and policies that are being made happen with the people who are most affected, sitting and shaping the way. It is critical for community to sit together, mobilize, educate each other, and organize advocacy, ensure about law reform. But how can you achieve this when members of the LGBTQ community cannot convene, continue to be persecuted or harassed week after week? It is taking a lot of time away from what could be the work that could be done to shift the policy, to change the narrative and get us the public health desires we all want to achieve. And it's coming at a cost of life. And I think it is critical that we all have to understand that the deeper the criminalization, the worse the public health harm. Because if people are injured, that also takes away from the time that the human rights for health is diverted from what they could be doing to address injuries. So it affects a whole aspect of the public health system. We heard from Matt earlier about this from the report and how countries that decriminalize have better outcomes. One of these countries is Botswana, who decriminalized same-sex relationship in 2019. And we can see how they were able to be the only country in the region that achieved the 90-90-90 targets and are on their way to achieving the current 95-95-95. So as much as the reports that we've just had from Matt and which we are launching this week gives us some chilling feelings, I'm also inspired every day by the leadership and the progress of the LGBTQ communities and allies, including people living with HIV. We continue to work alongside each other to challenge these colonial and discriminatory laws. And I hope we understand that this is not a cultural issue, it's a human rights issue, and we must begin to talk about it in this way if we want to address HIV outcomes at government to global level, we must ensure everybody accesses prevention and testing services. Back to you, Alice.
Thank you. Thank you so much, Florence. And just to remind us all, if you have any questions, I believe some of you already have questions after Matt's presentation and Florence's submission. Please feel free to use the chat room and the Q&A panel to be able to write your questions. And please let us know who you are directing your question to. Thank you, Florence, once again. And I would like to move next to my colleague, Richard Lusimbo, who's founder and director general of the Uganda Key Population Consortium. Richard, how best can we strengthen the collaboration between governments, civil society, and activists group, especially as we want to foster a successful pathway to decriminalization, considering the critical role played by various actors in, making change?
I was muted. Thank you so much, Alice, and thanks so much, Florence, but also Matt, for really setting us off with this wonderful report. I must say that Matt really gave a very vivid picture. Decrim is happening all over the world, so we cannot only say it's only happening in one region, but it's happening across the world. And I think that's encouraging, and also that shows that we have a lot of learning, especially countries like mine in Uganda, where we still have criminalization. And I think everyone is aware of what's happening, just as Florence did mention that a lot is happening in East African region, where communities have to look around survival and access to health services, and especially life-saving HIV treatment and care. So really to look at how we can strengthen, again, just as Alice has posed this question to me, I will start with something that I have always spoken about every time I have a chance, and this is around inclusive dialogue and partnership. We need to be having open and inclusive dialogue. We are together, government officials, civil society representatives, and activists, because these dialogues will help to build a mutual understanding and identify common ground. And it's really important. We can never say we've had enough dialogue. We need to continuously have this dialogue. I also want to say that what will also push us to this, to see really strengthen and really this collaboration will be joint advocacy and policy development. We really need to collaborate on advocacy campaigns, on policy. We need to see civil society and activists really providing their on-ground insights and innovative solutions, which can be instrumental in really shaping effective and humane policies. So again, this is something that we again have to do together. It's no one man's show. We all have to do this together. But we also need to focus on building capacities. Yes, one, we're looking at communities, we're looking at governments. I think one of the things, and again, we are seeing a lot happening. We are seeing in India, we are seeing in Seychelles, we are seeing in Botswana. There is need for different leaders across the world to really have that conversation where they have been ably dealt with the laws that have criminalized their communities for a very long time. So there's need for that capacity building. So those conversations need to, it should not just always be or focusing on just capacity as communities, but we should also look at capacities of all stakeholders and looking at legal reform, policy analysis, but also advocacy strategies. But government can also support the capacities of building initiatives for civil society and activists. But I think government to government really need to open up, just as I mentioned earlier. There is also need for resource sharing. Governments and international organizations can provide funding and resources to support the work of civil society and activists to ensure they have the means to contribute to decriminalization efforts effectively. To deal with issues around decrim, we need resources. There is need to support communities to continue to do the work. Look at what's happening in my country, Uganda. We are battling now. We in the Constitutional Court to challenge the recently enacted Anti-Homosexuality Act. These processes don't come easily, and they take time. So there's need to really resource the movements to ensure that they have resources to continue the work that they do. But there's also need to work together when it comes to monitoring and evaluation. We need to implement joint mechanisms to monitor and evaluate discrimination progress involving all stakeholders. This will help us to understand the impact of the efforts and make necessary adjustments. I want to say, and I'll share two examples here in Uganda to what we're doing. One, working with GNP Plus, we have been sharing every other year the stigma index. And this stigma index has expounded to all different communities. And it's really showing that actually criminalization is a key issue. And this is something that we need to be monitoring together. We also have the element of community-led monitoring that has helped us to bring issues that are deterring the community members from accessing services. Now, we need to do this together, government, communities, and this is what these efforts. If you look at the stigma index, we are working together with Uganda AIDS Commission. When it comes to community-led monitoring, we're working closely with the Ministry of Health and other agencies, and this is something that we need to do. We really need also to look at legal and technical support, and this is to help us to deal with the barriers, because as communities, as activists, we need to be operating in a situation and an environment that is enabling. But unfortunately, most of the time we find ourselves in spaces that cannot even allow for our mere existence, but also for convening, just as Florence really did share. I also want to say that there's need to recognize and look at protection. And protection for activists and communities is really important. And we need to really focus on this. As I conclude, I must say that adopting these strategies, collaboration can be strengthened to lead to more effective and sustainable efforts towards decriminalization and protecting human rights. Thanks so much. Over to you, Alice.
Thank you so much, Richard, and I can't agree with you enough. I know that there has been so much dialogue going on. If nothing has brought us together in the past, I think this report will definitely bring us together to be able to discuss lots of issues that we have been unveiled. For now, I will turn over to Ludo. Ludo is Manager SDGs and UNAIDS HIV and Health Group at UNDP. Ludo, how can UNDP, the UN, and the broader international community support efforts to build on the progress documented in this report?
Thanks, Alice, and thanks everyone for joining us today, and to our partners at the HIV Policy Lab, the O'Neill Institute, the Global Network of People Living with HIV, and UNAIDS for all the work on this important report. As you said, like, the progress documented in the report is remarkable, but I think it also makes clear that the report makes clear that the decriminalization is not the end of the road. We all know, and we've heard now from Florence and from Richard, that stigma and discrimination can persist beyond changes in laws. So this only underscores the need for continued progress on non-discrimination laws and the development of independent human rights institutions. The report shows, if you read it, there's a strong association between non-discrimination laws and independent human rights institutions that enables better progress on HIV testing and treatment goals. And it also shows that many countries are already taking this step to better protect health and human rights. 78 countries have anti-discrimination protections on the basis of sexual orientation, and 50 countries have anti-discrimination protection on the basis of gender identity. And we must continue to build on this progress, because the progress of the past few decades is not an accident. Florence was mentioning, it's the result of people living with HIV, key populations, leading the way forward towards decriminalization. And we need to double down on this, especially in this era where we see a pushback on human rights, gender equality, and civic space. So we really need to support these community approaches, and I'm glad that the theme of this year's World AIDS Day is around communities and the important role that they have in the AIDS response. So bolstering the capacity, capability, leadership of people living with HIV in key population, and as Richard was saying, making sure there's funding as well for this is essential to change laws, policies, and practices. And that's what we see from two of the most recent countries to make progress on decriminalization. Both in Mauritius and in Cook Islands, there were inspiring campaigns and leadership by key populations and civil society organizations. And these are not isolated examples, but evidence of a broader pattern that this is key to ending AIDS and discrimination against key populations. So programs like the UNDP-led Scale Initiative in collaboration with UNAIDS, the Global Fund, GNP+, try to do that, working to amplify the efforts of people living with HIV and key populations to counter punitive laws and policies and HIV-related criminalization, and really to drive further progress at the country level. So finally, because I know we also want to keep some time for questions from the audience, and if you have any questions, please put them in the Q&A box. The report also makes clear that decades of civil society advocacy are key to creating an enabling legal and policy environment that facilitates a full and sustainable HIV response. Since 2012, UNDP has been working together with government, civil society, UN, and other partners in 97 countries to follow up on the recommendations of the Independent Global Commission on HIV and the Law to protect marginalized people's health and rights. And the recommendations still stand. The benefits of doing this are so clear. In countries that have decriminalized, key populations who are vulnerable to HIV are more likely to know their HIV status and can access HIV treatment at significantly higher rates. So let's all work together on following up on the ideas in this report, the case studies, the recommendations of the Global Commission on HIV and Law to really support countries to move towards the 10-10-10 targets and continue down the road to decriminalization and non-discrimination. Thank you. Over to you, Alice.
Thank you so much. Thank you so much, Ludo. Once again, I want to remind us to, if you have any questions, please put your questions in the chat box, in the Q&A chat box. We'll be happy to respond to those as we get along. I want to turn to Vivek. Vivek Divan is founder and coordinator of Center for Health Equity, Law and Policy at the Indian Law Society. Vivek, we've had Matt share a few case studies with the stories that show positive progress from the different countries, Mauritius, India, Botswana. What insights do these case studies offer about the pathways to decriminalization, and how best can these experiences inform effective policy reform?
Thanks, Alice, for the question and for the invitation to participate on the panel. I will try and answer from largely my experience in India with a few insights on some of the global work I've done. I think one of the things that the India experience certainly taught us was that any successful attempt at getting the law kind of read down, as in the Indian case on Section 377 of the Indian Penal Code, was something which had to happen at several levels. Certainly in the courtroom, where the section was challenged, and therefore robust legal arguments. But as much as that, to really embed the case within the community, the affected community. And so what we did in India was a rich participatory process of a wide consultation. India, as many of you may know, is a very, very diverse country. It's humongous. It's kind of like Europe in many ways, in the way its diversity is, exists in language and all kinds of other ways. And so, bringing a community of queer activists together to act, and then the queer community more largely, was not an exactly easy exercise. It was painstaking, but it took several years of effort. And I think it was that strength which affected the case in so many positive ways. It ultimately, even in the courtroom. Um, and I say this because I feel that sometimes litigation can happen detached from the communities that one is trying to actually speak on behalf of. And I think in the India context, if we had litigated the decriminalization of gay sex in that detached manner, it just would not have been. It would not have had the ripple effect it did in society that it actually ultimately did. That was because we worked with communities. We worked also at the intersections of other movements and ecosystems, labor rights movements, women's rights movements, child rights movements, the HIV movement and ecosystem itself were companions in arms in many ways in supporting the call for decriminalization. And it stood us in good stead when we had setbacks. There were protests and organized protests that happened from the queer community, with all these allies kind of contributing to representing that anger. And that had a intangible but powerful effect on the way media reported the stories, the way therefore citizens digested this news around the unfairness of criminalization. And I think those are aspects which are extremely vital to influence legal change, which comes from a courtroom or from a parliament or from a legislature, so that you ensure that it actually it really has impact in society and in communities. So what you saw, therefore, was a very empowered queer movement, a highly educated queer movement, actually, on what the law is and what it means and how the judiciary functions, and what is my what is my relationship as a person in India to fundamental rights that we have in our constitution and to criminal law, etc. It was a highly educative process. I would say that is really at the heart of some of the illustrations, certainly, that the report covers. But I think there's a lot of diversity there in the way people have gone about seeking some of that change. And I'll just speak to one more point, since, again, I know time is limited. In my experience working at the UN on some of these issues, what I've also found is that there is great value in the cross-pollination of ideas. And that's something that the UN does quite well, which is it actually brings parliamentarians together, it brings judges together, it brings civil society together, it brings civil society and people in positions of authority together. It is able to create a forum for convening these so-called disparate kind of actors to actually educate people about why the law is useful for change. And I saw that certainly in the way in which, for instance, legal environment assessments that UNDP undertook in certain countries. I was involved in one, particularly in Bhutan, which also saw law reform. That sort of a legal environment assessment on HIV laws and punitive laws in the context of HIV required us to engage with parliamentarians, with judges, with the police, with communities affected, etc. And it began to create a conversation around why sodomy law in Bhutan needs to go. I'm not saying there's a causal effect directly between that sort of a study and what actually transpired, but these are the various little ways in which one can actually influence things. And I think that the UN needs to think about how it can use its good offices in the most effective way in such manners. I see a similar sort of cross-pollination of ideas which occurred through judicial interaction with judges in the Caribbean, for instance, or judges even in Africa, with other judges who've actually been engaged on these issues. And I think that was an educative process for all involved. And again, the UN has been able to facilitate some of that. So that's another aspect amongst many other aspects, which I think we need to remember when moving along on this journey.
Thank you so much, Vivek. Cross-pollination is one of those that I really pick out amongst the several very excellent points that you have made. We indeed need to have cross-pollination. Colleagues, comrades, friends, please write down your questions in the Q&A chat. We'll be happy to respond to those. I see many of them coming in, and I'll start off with a one to Matt, which is basically, do you see the increasing negative policies and language against trans people within the United States affecting the goal to end the HIV epidemic in the country by 2030, given that trans people, especially trans people of color, are disproportionately affected by HIV?
Thanks, Florence, and thanks to all of the colleagues for the really interesting and enriching conversation so far. Look, I think what we know is that there has been a wave of anti-trans laws imposed in many countries around the world, including the United States, where I sit. And those laws, we don't, many of them are taking new and deeply problematic ways to push people to the margins. That rather than criminalizing gay sex, which has been rejected by the majority of people and therefore is not a viable way forward, the turn has been to new and problematic ways to impose penalties on folks, especially including trans folks here in the United States. But this is being exported around the world. What we know is that when you make it impossible for people to engage in public life, that undermines our ability to get the kinds of leadership we need to be able to actually end the AIDS crisis. We also know that so many of these laws are aimed at pushing back the public sector's ability to talk about, teach about, engage with communities of LGBTQ people, and especially trans people here in the US. And that means we undermine, for example, effective comprehensive sexuality education. That's one of the things that we know is tied empirically to better HIV outcomes. And if queer people around the world are unable to get good information about their own sexuality, that actually undermines the ability to fight AIDS around the world. And so that's just one example of where that happens. Where criminalization drives people away from services, that is the key finding of a number of the different pieces of research that we highlight in this report. And unfortunately, thus far, we don't have good data, fortunately or unfortunately, because the history is not that anti-trans laws are standard around the world, right? These are new and innovative ways to criminalize people and to push people out of public life. And they're deeply worrying. If they spread, we will have much more data on their impact, and it will almost invariably be negative. Everything we know from the AIDS response is that when you marginalize people, it undermines our effective ability to respond to the pandemic. So yes, it's deeply worrying. The data, is yet out, but I think we've got a lot to learn from what has happened so far.
Wonderful. Thank you so much, Amat. The next question we have is to Florence and Ludo, and this is from our dear friend Leslie Odendel, who says she cannot agree more with Richard regarding the need for resources. As he always says, advocacy is expensive. We have seen from some data that the anti-gender rights movement is outfunding HIV 1-4 and is outfunding HIV 1-4. And this is the funding we know of. What can be done to increase funding for decriminalization work, keeping in mind that it is hindering our progress on other HIV program outcomes?
I can go first, Ludo. Do you want to go first?
I was about to say, who do we want to go first? Florence, go ahead.
Okay, so thanks, Leslie. Such a good question. This is a good question. I think pertinent issues raised here, and we need to figure out how to make a case for funding for decriminalization, but not only decriminalization, funding that seeks to address inequalities and address social barriers to services. So generally, we have commitments within the political high-level meeting declaration, the political declaration on HIV and AIDS, on addressing the 10-10-10 targets. And the first target is on addressing laws that make it impossible for people to access services. I think we need to make a case, and I'm saying this understanding that we are in an environment that is increasingly regressing on rights, and laws are completely regressing on progress that have been made. And we are seeing high-level regress as well on gender equality. And these are the realities for which we are working now. But this is why there must be a global solidarity around the push, the move, using evidence like the report we have now to show where there is decriminalization, what is the positive impact, and then create a case for the people who are funding the various aspects of HIV response, but also create a narrative around the cost of not funding for decriminalization. I just wanted to say some of the things that we are proposing in our conversations with UNAIDS and others is to challenge a little bit how we also report on progress at country level. So we have the GAM, and it's a great useful tool, but some of it sometimes is too biomedical and numerically oriented. So how do we merge these two? We have the 95, 95, 95 targets to reach, but we know they cannot be reached if it's not, encapsulated within addressing the 10, 10, 10, which are the social barriers. So can we find a way in which countries are reporting on the progress of reaching number of people found and tested, put on treatment, virally suppressed, alongside what they are doing about their laws, gender equality, stigma, and discrimination? If countries are required to make this report this way, my understanding, having worked in this field, is what is reported or must be reported will be planned for and resourced. So maybe let's start from there. Yeah.
As we like to say, measure what you treasure, and otherwise no funding will go there. No, I agree. I think the political declaration is a really key thing. And besides the 10-10-10 targets, as Matt said, this is like a amazing opportunity, and the first time that we have such concrete targets on really addressing societal enablers. I think the other set of targets, talking about what we need to measure, are the 30, 60, 80 targets, which basically say that 30% of all testing and treating, 60% of all societal enabler work, as well as 80% of prevention programs for key populations need to be implemented by community-led organizations. So I think that's a really strong tool that we have for advocacy. And I think we need to then make sure that when your country goes into developing the next global fund proposal, make sure that there is a strong push from the community to really address societal enablers, human rights, gender, work with the community representatives on the CCMs. I think another possibility or opportunity is, especially in countries where there's less international funding, is to work with the UN and other partners to push for social contracting, where civil society gets funded through the government to undertake services. And then finally, as the UN and with others, we can support in sort of capacity strengthening and advocacy around this need for further resources for communities, civil society, and especially the important work around societal enablers. And I think more and more, I think the penny is dropping that we've done the testing and treating, but without really addressing the societal enablers, we're never going to reach the end of AIDS. So let's all work together on that. Back to you, Alice.
Thank you. Thank you so much. Thank you so much for the information that you have shared on the different issues. And for now, I want to perhaps I'll first turn to Richard. Richard, you have a question on how are advocacy groups addressing the influence Christian evangelical groups have on influencing policy and social sentiments in sub-Saharan Africa, and how is the religious community being engaged?
You know, after doing this for some time, you think you know how to do with Zoom. Thank you so much, Alice, and thanks for the question again. I think just as Alice really shared in the question Q&A, is that the anti-gender and anti-rights groups are well funded, and they are having lots of resources, and that's why you see a lot of influence going across the globe. You'll see that recently in Uganda, towards the end of March, we had a whole big conference that had members of parliament from different African countries, that had all groups from the US, like Sharon Slater, who were in Uganda to give a sense of direction on how our leaders should be looking at the values of an African country. Now, that says a lot. If we are having someone from the United States coming to lecture our own leaders on what African values and family is, that shows you that there's a lot of power that we are dealing with. So one of the things that we're doing is really like sounding the drum and really putting it out there and saying that this is really happening, and continuously mentioning and where these different individuals are going and supporting. I'll also say that in the past, in Uganda, we had an American evangelical like Scott Lively, who supported and who helped in the drafting of the first anti-gay law in Uganda. And Sexual Minorities Uganda successfully took a case in the federal court of the US in Springfield, Massachusetts. And this said a lot. While the case, we might have not won the case, but it also showed that actually we know what different people are doing, but also it was a reminder that if you bring homophobia from your country, we will definitely follow you up. And I think this is the message that we are trying to put across, that enough of just mentioning that African countries are homophobic. It is time we started to discuss and mention where the homophobia is coming from. Let's not hide away. Let's not shy away. We know the reason why we're facing all this is because we're having evangelicals, extremists coming from the US, coming from different parts of Europe. And I think we need to discuss this. We also need to talk about the role played by the colonial legacy. The reason why Uganda had even a law that was criminalizing same-sex conduct is because of the British rule that we had. They left us the penal code that they directly got from India in 1950 and made it Uganda's law. And that has gone across different countries. It's the same that was in Botswana. It's the same that is in Kenya and other countries. And I think this is the time to really have serious conversations, that we need to hold each other accountable. And let's not just be always pointing fingers, but I think we need to start pointing fingers in the right direction, which is the source of all the problems that we are facing now. Thanks.
Thank you so much, Richard. And just to mention, for those who will be at ICASA next month, there will be a discussion on engaging faith-based leaders and faith-based organizations. And the O'Neill Institute will be proudly associated with the team that is going to organize this symposium. And we will be, presenting these findings again and discussing them in detail, in line with faith-based, anything around faith-based. We have a question from one of from the audience, and this is to you, Florence. It's on about Botswana, saying that the successes recorded with Botswana are quite commendable, and it may be beneficial to adopt some of the measures employed within the region. I am curious as to how they were able to obtain critical government or stakeholder buy-in to decriminalize same-sex relations, and what role public health research institutions had in this entire process in Botswana?
So I want to start by saying I'm not Botswanian. I don't know if that's even the word, just so that I don't look like I know what happened there in detail. I think there are some commonalities around what is practice and how these goals are realized or achieved. And it's happened for issues around realizing decriminalization of same-sex sex, realizing decriminalization of HIV transmission, from which I think that's where I have more experience. I think the start of all of this is there's always a community movement building around the topic and educating each other about the opportunities and the realities that exist within our constitutions, which provide so much in terms of our rights to access of different opportunities and benefits, for which we anchor this work. Again, there's a lot of allyship that comes into this public health research, provides evidence and data like also what we are releasing from this report, but in-country organizing of data and making cases to different players and stakeholders. I think ministries are important, but also even out of government, the legal entity and the fact that they are independent and have the capacity to make judgments independently is a rich ground for accessing such outcomes. And community working with, there are certain legal organizations or NGOs that work alongside communities to organize legal, I want to say reforms, but people go to court and then there's a legal process, because for many of these successes, you'll realize that we shout and win. A lot of the work goes on to educate and teach, but in most instances, these wins also happen because there's a whole movement around education and awareness within the legal departments and working together, civil society and people within the legal departments and lawyers. So there's opportunities. I think we connect with other legal experts within the HIV justice worldwide and network, and there's a whole lot of precedent cases that you can look at and how some of these wins are realized. We have within us the Not a Criminal campaign, which we are having together with the HIV Policy Lab, who are really using the evidence to help us push for our criminalization advocacy and campaigns. But it's a concerted effort. I think Vivek has actually engaged with it directly to know more about it, but just to highlight that, let's just be clear that in certain situations, there are court processes. Richard has alluded to the court process they are currently in Uganda to actively fight the law that is currently criminalizing people in Uganda. That process requires money, requires time. I've seen these processes take up to 10 years. Along the way, people leave us. It matters to us, we stay here, and that's why we must also ensure that the evidence keeps coming and it keeps being updated and it keeps showing where progress is happening to also help countering and probably making our governments make the right decision, but it requires an independent legal system. I hope that answers the question.
Thank you, Florence. You're not a Muswana, but at least you have been able to speak very effectively. And, you've represented them all the way from Kenya. I see that we are at the top of the hour, and I will ask for just a few more minutes from you all, perhaps just a little below 5 minutes. And I want to ask my second last question to Vivek. Vivek, a question to you is, what did it mean for you? What did it mean to you personally when India decriminalized? What impact did it have on you, on your friends, on your family, on your community? And were there any social impacts generally?
So because the case was embedded within the community for so many years, since 2001, the impact on the community was significant in the sense that, like I think I tried to explain, there was engagement with the media over long-standing time. There was engagements with collectives of parents of queer people. There was engagements with mental health experts, with labor unions, etc. And so you saw people feeling that this victory was as much their victory as anyone else's. And therefore, then you saw that ripple effect in society. You saw also a kind of courage within the LGBTQ community to now start claiming certain rights. So, for instance, immediately after we won in 2018, you saw a slew of cases in various smaller courts across the country where particularly women couples, lesbian couples, were seeking protection orders from courts because one of their families was trying to, act in violent manners against one of the partners, etc. And you saw courts proactively saying, this is a protected relationship, no one can interfere. So you saw that kind of ability to say, okay, I'm going to court, this legal system doesn't intimidate me, I've been decriminalized. And you saw that incredible impact. I don't think that would have happened if the case was not rooted within the community. In terms of personally, I was relieved because I've been part of this for 20 plus years. So it was a sense of relief more than just ecstasy. I think the ecstasy came in 2009 when we were first decriminalized, and then we were recriminalized in 2013. It's a complicated story, which I don't want to get into. I should say that I think the impact in India, as in many parts of the world, I would think, where society is deeply classist, plays out very differently. I come from privilege and therefore have had the support of my family from day one, way back. But I think there were people in much tougher contexts for whom it was a deeply liberating experience. Shackles were kind of broken in ways in which one can't, I would not be able to even describe, because there were oppressive contexts within which people were able to say that, okay, now the Supreme Court of India actually sees my point of view. So there's that. Can I just say one more thing quickly, because I saw a couple of very interesting questions in the box. Someone said something about the intersection of sex work with LGBTQ. I think it's a vital intersection. I think someone also asked about how international orgs, LGBT organizations across the globe can be done to reach the global community. I think some of those organizations speak on the one hand of a very strong anti-trafficking law while speaking for queer decriminalization, not realizing that those two things clash, because strong anti-trafficking laws means the oppression of sex workers and the recriminalization, the hyper-criminalization of sex workers. I cannot emphasize enough that these are complex things that we need to take completely on board. You cannot stand for hyper-trafficking, anti-trafficking laws, which are blind to the nuances about the way sex workers negotiate life. At the same time, say we're pro-gay LGBTQ. It's just not acceptable. And I think global organizations need to get this before they speak and spout out their so-called advocacy.
Thank you so much for your statements, Vivek. And I would like to end with Matt, a question to you very, very quickly as we wrap up. A question to you, Matt, on there are many LGBTQI organizations across the globe. What can be done to reach and galvanize this global community?
Thanks everyone for a great discussion. And I think that I will just reemphasize the point that's been made several times, which is, where we understand law reform to be a critical piece of fighting the AIDS pandemic, but frankly, fighting all sorts of pandemics and improving economies, et cetera, et cetera. What we need behind it is a stronger movement, a more funded movement, a better structure to ensure that that happens. And in fact, what we are seeing, and the worrying piece, is we're seeing a lot of donors say, I've done my work on HIV, I think I'll close, right? I'm done with this. I'm shocked by the number of different donors who have decided that they want to move out of doing and supporting some of the HIV organizations without understanding the depths to which it is many of these organizations that have been critically involved in these pushes to change laws. And at the same time, I don't think we've done a great job of funding and supporting the kinds of intersectional movements that Vivek is talking about that really connect across the globe to ensure that some of that happens. And so the HIV movement and HIV organizations writ large probably need to do more to step up and stand in movement and stand in relationship there. I'll just say in final closing, right? I mean, at the start of the AIDS response, just to repeat, 2/3 of countries criminalized And this year, 2/3 of countries don't criminalize. And that is a big part of why we've made as much progress as we have in the AIDS response. But of course, more is deeply needed. There is an organized effort to push back against the progress that's being made. And we need as organized an effort to ensure that we actually continue law reform and that we move from 2/3 to 100%, and that we move into the world where non-discrimination pieces are central. So I'll leave it there, and thank you, Alice.
Thank you so much, dear panelists, and thank you so much to the authors of this report. A huge thanks to our audience. We have been so happy to have you join us for this discussion. As you can see, there is so much that still holds for us to continue in dialogue, and so the conversation continues from here. We are not ending here at all. Please pick up this report, use it as much as possible and in all possible ways. We trust that this will be a very good tool that we will be able to use in our advocacy for decriminalization. We hope to see you again. For those going to ICASA, we will be there. We will see you to continue the discussion. Thank you and have a very good day, good evening, and good afternoon. Bye.